Hi everyone, I'm Neha Gorin. I'm the Senior Director of Cancer Care at Boston Medical Center, and I'll provide an update on what we've been doing to prepare for COVID-19. Our actions fall into two broad categories. The first is protecting our staff, and the second is making sure our doors stay open. To protect our staff, a lot of the work we've done is to reduce foot traffic upstairs on Moakley 3. So that includes our providers going week by week and looking at which visits they could reschedule and or convert to telehealth, all of which has been supported by our incredibly dedicated front desk team who has been reorganizing hundreds of appointments per week. We've also introduced a screening in our lobby, which is staffed by one of our infusion nurses to check for patients and visitors who may be symptomatic and redirect them as appropriate. Our incredibly talented group of patient navigators who've been working from home have been calling a subset of our infusion patients the day before to check for symptoms and potentially avoid a visit altogether to BMC if appropriate. And finally, we've canceled all of our upcoming support groups and celebrations in order to adhere with the recommendations of social distancing. So collectively, the hope is that those actions really do minimize foot traffic upstairs, reducing the potential exposure to COVID-19 for our patients and for our staff. Alongside all of that, we've been thinking about how do we remain open, because a lot of our patients do need to continue to get access to our treatments and our providers. So I work alongside an incredibly talented group of providers, nurses, MAs, ASR, navigators, team leads, and managers who came together this past week to think about how would we provide an infusion for a COVID-19 positive patient if we're presented with that situation. So we thought about what exam rooms would we use, what gear would we wear in order to ensure access in a high quality and a low risk way. And the hope is that for some of our very vulnerable patients, we're able to continue to provide access to treatment in Moakley 3 and avoid an admission in the ED or to the inpatient wards. And so a big thank you to everyone on Moakley 3 who's been coming to work every single day. And I think I speak for all of us when I say our message to all of our patients, be it a cancer patient or an infusion patient or a hematology patient or a sickle cell patient, is that our doors are open and we're here for you if you need us. Thank you and stay safe.